Sounds like kind of the fountain of youth. Use a pill, a patch, maybe cream, and have more energy, even better sex drive.
But now some doctors and even a federal agency are sounding the alarm on a popular treatment. I-Team reporter Ginger Allen joins us now with more on low testosterone.
You know, low testosterone, or low T, is a very legitimate condition, but studies show the number of men being treated for it has tripled over the last decade. Doctors say not all of these patients need it, and not all of them know about potentially deadly side effects.
Michael, get the game.
Don't have the hops for hoops with your buddies? Lost your appetite for romance?
The ads are everywhere, on TV, the internet, even on the side of Central Expressway in Dallas.
You might not just be getting older. You might have a treatable condition called low testosterone or low T.
Low testosterone is a very real problem, and those who suffer from it need hormone replacement drugs. Robert Trissati is one.
It certainly helped increase my drive and effort, focus to feel more like I felt when I was younger. So that's been a big part of it.
And so is 51-year-old Ed Downs. The Philadelphia man used a hormone replacement gel for 2 years, but his results were much different.
And I thought, well, it might be something good for me.
Downs says it did give him more energy and muscle mass. But then, out of nowhere, 2 years ago, he suffered a paralyzing stroke.
It has been hard. It's, I can't count on them to do a lot like you used to.
I think too many men who don't need it are getting it, and too many men who actually need it are not getting it.
Dr. Eugis Grootmanis of UT Southwestern is careful not to point fingers at any one hormone replacement drug maker. But he says too many men are asking for the treatment and too many doctors are prescribing it. A recent study out of UT Galveston shows nationwide testosterone therapy from 2001 to 2011 has almost tripled.
Have these commercials gone too far?
I cannot talk about every commercial, but ones I have seen, I think they are thin on possible side effects.
A study published in the Journal of the American Medical Association late last year found patients on testosterone have a 30% higher risk of stroke, heart attack, and even death.
The new research began raising red flags with the FDA, so it sent out a public safety alert about the possible side effects. And then when the I-Team contacted the regulatory agency, we received this email. The FDA says it is now reviewing all available data on the cardiovascular safety of testosterone products. This recent FDA warning has raised some red flags in your world.
When FDA makes a statement like this, it raises a bar. So so the question, I think, what many of us have to ask, why did this warning came out?
As doctors and the FDA dig deeper, some patients are taking action on their own. The I-Team has learned they've filed more than 70 lawsuits nationwide against drug companies involving testosterone replacement therapy. Patients like Ed Downs say they are victims of an aggressive campaign touting products without adequate warnings.
I just wouldn't want this to happen to any other family that we had to go through.
Now, some health groups are petitioning the FDA to enforce stronger warnings on the labels of these drugs. So far, the FDA has not concluded that the therapy causes these increased risks. If you are on the medicine, this is very important. Do not stop taking it. Just go talk to your doctor about it.
Yeah, doctor always, I would think. So as far as the manufacturers, though, of the products themselves, do they agree that they cause risks to the, with what they're hearing out there?
No, not at all. In fact, we talked to the makers of one of the biggest manufacturers of these products, and she said the company has 10 years of clinical data showing hypertension and blood clots in the legs, but they are challenging these studies, which suggest the heart failure, the strokes, and even the death.
Okay. All right, Ginger. Thank you.